All right. So like what we mentioned, so Entonox is the gas, the laughing gas. Okay. So what the laughing gas does is that it makes you feel a little bit drowsy. So it helps to take the edge away from the pain. So the pain relief that you get from Entonox, right, usually is not. It's like, okay, if you tell me the pain score is about 8 out of 10, with the gas, maybe it drops it down to about 6 out of 10. So not a complete relief, but it makes you feel a little bit better lah. For some women it works well, for some it doesn't. So I mean, it's something that you have to try out to see. But although we call it laughing gas, trust me, you're not going to laugh at all. You probably just feel very knocked out, like you had a few drinks. Okay. It can be used concurrently with intramuscular pethidine. So that's the jab that we give on the thigh, the usual kind of pain relief that we give for people who have surgery and things like that. Okay. So these two can be used concurrently. It's not one or the other. But pethidine can cause the baby to be drowsy because it goes into your body system. So we tend not to give it if, let's say, you are already like maybe 6 centimeters or so, because the chances of you delivering within that 1 to 4 hours is higher. So, and then that's when the baby can be drowsy. But if it's given the early stages, like sometimes when you're still 3 cm and you're hoping that, okay, you can avoid the epidural and things like that, that's when we give the pethidine. Okay. But touch wood, I mean, in case if you happen to have it and you progress very quickly, the baby comes out and is drowsy, is not something without, there's an antidote for it. So usually when we notice that a pethidine was given close and the baby was a little bit sleepy, then we normally give an antidote to the baby and the baby will actually very quickly wake up again. Okay. And of course, the one that gives the best form of pain relief is epidural, but it is the most invasive. Okay. So now, epidural, of course, everybody gets a bit scared because it's an injection at a different site, but it's actually similar to, the size of the needle is a little bit thicker, but it's just that it's injected in the back rather than on your hand. Okay, so what is finally left in the space is actually just a plastic tubing there, like this. Okay, so the needle is just helping to guide this plastic tubing in only, and then this catheter will then be taped on your back so that it stays there. Now, so if it works, basically you'll be a lot more comfortable. You can actually watch TV and all that. In about maybe 5 to 10% of women, sometimes it doesn't work so well. The reason being, because you see, when you put in if you can see my cursor here, when you put in the plastic tubing, sometimes it may not go the direction you want to. So it may flop more to one side than the other, or sometimes there can be fibrosis or blockage in your spinal canal that actually affects the flow of the medication. So sometimes when it doesn't work fine, the anesthetist may try to reinsert again to see whether it works better the next time. And most of the time, it works lah, okay? So not to worry too much about it. And the epidural will last as long as you need it. Once you have delivered, after about half an hour or so, they will remove the epidural. So if your labor happens to be long, because it's like a drip, so they will just attach another bottle of medication to pump in. It's not another injection that you need. Okay. Now, if you are hoping to do without pain medication, then you can always consider getting the TENS machine. The TENS machine is almost like using acupressure sort of thing. So it's like a machine that you attach probes on the back, so it buzzes a bit, so it sort of like takes away, like just like if you are scared of pain, right? You rub your skin a bit, so it distracts you from the pain. So that's how a TENS machine works. Okay, and sometimes being on certain positions may help with the pain as well. So that's why some people like to walk in the early labor to take the edge off, sometimes lying on the side or sitting forward, because in some cases where the baby is pushing against your spine, it can be very painful, very achy, especially when you lie on the back. So sitting forward helps to ease off that pain. Okay, so you try ways and means.